Well, we're here with another episode of Health Matters, and we're in conversation with Dr. Max Disa. So, Dr. Max, it's very, very, very privileging to have you here. How long have you been practicing?
I've been practicing for the last 30 years, and if you say tuberculosis, this is my pet subject. Why do you say it's dead? So, because I've been working for this for the last 25 years of my career, out of which 19 years I've spent in a clinical side, actually examining the patients, being with the patients in both the TB hospitals in North Goa as well as South Goa.
Okay. We're very glad to have you here.
Yeah.
A health issue such as tuberculosis, something that is so prevalent, as we know, and we've heard about it off and on. What made you take this as your pet subject?
See, basically I post-graduated in tuberculosis. Means I've done my MD in tuberculosis and chest disease.
Okay.
That was way back in some 25 odd years. So, and I've done my thesis also on the subject.
All right.
And as you go deeper into it, I've started more of getting involved with this, and then what to say that the more you get involved, the more you like to give up. I mean, give out to the
patients and the
public.
people who are there. We're very glad to have you here to tell our viewers more about tuberculosis. The first and basic question about tuberculosis is tuberculosis is known to be a chest disease or a lung disease.
Yeah.
Can it affect other parts of the body, or is it just lungs or a chest disease?
Basically, it affects the lungs, 85%. It destroys the lungs, and you get a hole in the lungs, and people get all sorts of symptoms. Even later stage, even they cough out blood. But it can affect any part of the body. In fact, every organ of the body is being affected, right from the head to toe. There's no organ that is spared except the nails and the hair, where there is no blood supply. Otherwise, every organ of the body is being affected. That is called extrapulmonary tuberculosis. And of late, there's been a rise of these extrapulmonary cases.
All right. Considering you're saying it is where every part of the blood is in your body, tuberculosis can affect you. So, what's the transmission? Can one person infect the other with contact, or what is?
Mainly, it's an airborne infection.
All
so, right. And the main symptom of a tuberculosis patient is he coughs out. When he coughs or he talks or he sings loudly, the bacilli can get excreted out. A person, when he coughs out, he can infect the person next to you. Okay? Even at an arm's distance. Okay, that's why they say keep an arm's distance. It's like any other viral infection or airborne infection. So it spreads so easily that even if you stay in a closed atmosphere like this with no ventilation, if one person coughs out, he has tuberculosis, it can infect everyone around.
Wow.
Now the infectivity of a country, the rate is 40% of our population is infected with tuberculosis. 40%. So that means if there is a population of 1.2 or 3 billion, about 4.8 million or even 5 million cases of, 500 million cases are already infected. 40% of our population is already infected with tuberculosis. But that doesn't mean that they have tuberculosis. It's only when immunity gets decreased, this bacilli, which remains dormant, can flare up and manifest itself into a disease.
All right. So let's go back to the point where you said if you're in a closed space, that means that a family member of a person with tuberculosis is at a high risk of getting tuberculosis.
Yes, of course. There's a high probability that that person will get tuberculosis, provided his immunity is good, where he can contain the infection, means he can control it, his body mechanisms, his defense mechanisms can control it. But if his immunity is less, then he can succumb to the disease.
This is about transmitting from one person to the other. By itself, without anybody transmitting it to you, who does tuberculosis infect? How does it get into a person? Can it be born from inside your body? Does it happen to a person?
Normally no. It goes from person to person. And you said, see, you need not need the person to be close to you. If you are here in a room and there's a split AC, there's no window AC, but a split AC where the same air gets recirculated again.
Correct.
If you're in a superstores, or even if you're in an aeroplane, where the same air gets recirculated. It's not like the window AC where the air comes out outside and is drawn in. So it can easily, if one person coughs out and a bacilli is in the air, this bacilli can be circulated easily, especially in areas where there's centralized AC.
So a lot of us are at high risk at
I would
at
always
40% given of the time.
prefer the older settings where the open air or open windows will give a natural ventilation rather than split
ACs.
Okay, so it depends also on the infectivity of the organism, how much a person can take into his bacilli, and what is the immunity of that person, the inborn immunity to fight this.
All right.
Now, as you said, as you just asked me, there are no barriers. Anyone can get infected. Normally, tuberculosis was said to be a disease of the poor and this thing socially backward, but no longer so. It affects all strata of society, even people with good medical. In fact, we have a lot of professionals. We have who have tuberculosis.
Okay.
A lot of professionals. Even we have seen a lot of professionals, IT professionals, the medical professionals, chartered accountants, and those who are in highly stressed conditions.
Correct.
Okay? So one of the things, your lower immunity, your immunity doesn't. It's not only your food. Malnourishment is of course one cause. There's also things like stress. Stress reduces immunity. Then immunocompromised states like HIV, diabetes is one of the conditions where immunity goes down. So these people are more likely to
grab it. In so many different scenarios, you said 40% of Indians have tuberculosis.
Are infected with tuberculosis,
but they don't.
Out of that, only 10% develop a disease in a lifetime.
All right. What about Goa?
In Goa, there are about 1,500 to 2,000 cases. There are reported cases are about 2,000 cases, but there might be many more who are not been reporting to us, who prefer going to the private sector because of stigma. They don't want the next door neighbor to know that he has tuberculosis. So in such a situation, we don't know what is. It happens all over the country.
Correct.
Especially in Goa, where the private sector is very strong. There's 50%. 50% of our patients prefer going to the private sector. Even those who cannot afford, they prefer the private sector for the simple reason they don't do.
Because it is a transmitting disease, and everybody would then be,
they would like the next. In fact, there's nothing wrong to disclose it, but that's a stigma.
It's a stigma.
We have tried our level best to say that it's a curable disease, but that stigma is somehow ingrained in them.
So, Dr. Max, you've come very rightly to the cure. What about the diagnosis and the treatment of tuberculosis in Goa?
Yeah. The diagnosis is mainly done only by sputum. The sputum of the patient. The patient gives out a sputum or any biological specimen, except blood. People think you can check a tuberculosis by blood test. There is no blood test. In fact, most of these tests that come for blood tests, the IgM test and all, or IgG test, they are not recommended by WHO. The basic test is the biological specimen, which goes for sputum or an X-ray, and there is a latest test called CBNet.
All right.
It's called cartridge-based nucleic acid amplification test. This is a PCR test, a gene expert. It's also called a gene expert, a trade name. It diagnoses tuberculosis within 2 hours.
All right.
So you put the sample in the machine. It's an automated machine. After 2 hours, you get a computerized result. How much is it where TB detected and how much is the load?
Okay.
We got 2 of these machines in Goa right now, one in north, one in south.
Okay.
It's an expensive test. It costs about 3,000 per test, but the good thing it's given free to our patients in Goa.
Where in north and where in the south?
In north, it is in Department of Microbiology at JMC,
right.
Goa Medical College, and south at Auspice.
All right. So these are the 2 hospitals where you can go ahead and get a diagnosis of tuberculosis absolutely free in about 2 hours to, I think, because of the patient's 4 hours. Right. Knowing that the diagnosis can be done, what about the treatment, Dr. Max?
The treatment is also given free of charge. Right now, initially we were intermittent therapy, but now the government of India has rolled out this daily anti-TB treatment where you daily take a tablet, and it's a long duration of treatment for 6 months. So when the treatment is taken for 6 months, you have to be regular. The cure is almost 98 to 99%, provided you are regular with the treatment. This is called daily WHO approved regimen. The drugs are also WHO monitored drugs. They undergo testing, a rigid testing with all these biomedical standards. and they are the best drugs we get. Though it's supplied by the government of India, but they have undergone the strict regulations.
The quality is very high.
Very high quality. And these drugs are available free of charge.
All right. What about now, before we got to the public treatment and diagnosis, we were talking about the private sector.
Yeah.
So what about the patients who have tuberculosis, to have the stigma and go to the private sector? What would their cost be to get diagnosed and treated?
Now the cost of tuberculosis is quite high, about 2,000 rupees. I just spoke to you about a test. The CBNet test is quite a costly test.
Correct.
But if a private doctor notifies the patient to the public sector, notification, okay, let me come to TB notification. There's a TB Notification Act. Act means a law. It's an act. It was gazetted by the government of India. Also, it appears in Goa Gazette also. Every TB patient, whether in public or private sector, has to be notified to the public authorities. It has to come to me. Every private sector has. Because most of our private doctors do not report for obvious reasons. Of course, the privacy matters not. But the government is still firm on it. It's a notifiable disease. Even though we sacrifice privacy, it's for the good of the public. So that there's a certain area there are more tuberculosis patients. More awareness could be created. More diagnosis could be held in places.
Yes.
So, and also to help the private patients appropriate drugs from our public sector. Because the same drugs which are supplied free of cost to the people who are approaching the public hospitals or medical college or health services can also be given to the private sector, provided a doctor notifies.
Are there paid? Of course, if they don't notify, then it goes the other way. Do the private sector patients have paid drugs for tuberculosis where they go ahead and have pills?
They pay the private chemist.
All right.
But why pay when it's offered free of cost from the government sector? It's available free of cost. We have my staff all over Goa from all the health centers. We have already approached the private sector and we told them to notify patients. Thankfully, all our chest physicians, because they are all my colleagues, have also graduated from I've done my MD in chest. So all one of those MDs in chest, they notified to us. But there are still pockets where doctors for private practices do not report to us. So what we did, we tried the other way around. We approached the FDA, this Director of Food and Drug Administration.
Correct.
And after a lot of deliberations with them, recently this last month, January, they came out with a circular.
All right.
A circular to all the private chemists that they have got to report the number of drugs which come on a Schedule H1. The TB drugs come on a Schedule H1. By meaning Schedule H1, it means any drug, this list of anti-TB drugs, this comes on Schedule H1 cannot be sold unless doctor's prescription, and it has to be documented in that register.
Correct.
So every month, the private chemists all over Goa send a report to the FDA. And FDA, they email the full set to us.
You've put in a foot over there and you now monitor it.
Yeah, to monitor it, to see where the
extent.
reports are not coming from, so that we can approach the private sector. Everything is done in good faith, okay?
Yes.
This is a TB Notification Act. Act has to be followed, but we don't use any penalty for that, okay? There's no stake, only carrot.
Correct.
Okay, carrot approach is there.
I think what Dr. Max is trying to tell all of our viewers, especially if you're a chemist or you're into the medical fraternity, is that notifying, the authorities is for the betterment for everybody around. They're trying to raise more awareness because it's a transferable disease. So the more we know about it, the better it is.
Yes.
That brings us to a very important question. Any latest, efficiency drugs that have been tested and any research that has come out which says you can nullify the effects of TB or you can bring it, downsize it?
Okay. Before I come to that, I'll come to another thing that's coming up. See, the incidence of tuberculosis has taken, of course, it's all over the world. We're making efforts to decrease it. But there's another form of tuberculosis that's coming up. It's a drug resistant. It's a deadly form of tuberculosis. Okay. A multi-drug resistant, or you must have heard about Mdr Tb or XDR Tb, extremely drug resistant tuberculosis. It doesn't respond to these standard drugs, these 4 drugs, and you have to take something like, you have to take what you can complete in 6 months, you go on for a period of 2 years. And this is 2 years, very toxic drugs. And the efficacy of this treatment is only 50%. Whereas basic standard TB drugs, 99% cure. whereas this is only 50%. So when you have this Mdr Tb, it's very difficult to treat these cases, but it is 50%, cure rate is 50% all over the world. Now, what is Mdr Tb? It's a drug-resistant TB when a patient is resistant to two of the main drugs treating TB, rifampicin, that's an anchor stone of tuberculosis, and INH, isoniazid. When they're resistant to these two, there are 4 drugs initially. The other 2 also become incapable of attacking the germ, so it becomes a resistant form. And then you give a 6 months course, a 6 months intensive course plus 18 months, so 2 years course. So this is Mdr Tb. And Mdr Tb is 50% effective.
How does this occur, doctor, this drug-resistant tuberculosis?
Yes. If a patient is not regular, that's what regularity of treatment is very important.
All right.
Now, this drug resistance is a phenomenon that occurs in any particular, you must have heard, even if you go for any hospitals, any operations, the nosocomial infections are there, antimicrobial resistance is very common, not only in tuberculosis.
In many diseases is what
if you have a common cold, if I give you a prescription for cold for 10 days, and if you're not regular, you'll get resistant to it. So the drug
okay.
Same way it happens with tuberculosis. So this drug-resistant tuberculosis, they are rendering even this present drugs is ineffective. So now the latest drugs that have come in is bedaquiline. Bedaquiline is the latest drug. Mm-hmm. It was they had a trial in US. Last year they had a pilot project in 6 centers in India, and now from this year they're going to roll out.
Right.
This will shorten the duration.
Okay.
Then there are other newer drugs like delinamide, protinamide. They're still in their life.
All right. What are the cases of this? I'm curious of this drug-resistant tuberculosis in Goa. Is it?
In Goa, there are about 100 cases, about 190 to 100, about 60 to 90 to 100. It varies every year. If you ask me, globally, there are about 4 lakh MDR cases, 4 lakhs out of 4 lakh cases, out of which about 99,000 are in India alone. India, that is a WHO estimates. Mm-hmm. Those who may be treated by private sector and the public sector, there's an estimate. Whereas the reported cases every year, about 20 to 29 new cases are reported in India. New cases.
How do you diagnose this MDR?
That is done by, we have a LPA technique, liquid cultures technique, but the latest is the CBNet.
Correct. It also goes ahead.
Within 2 hours, okay. And the government of India has given us CBNet machines, about more than 700 to all the districts in India. We are lucky to have 2 of them. That's how we get a rapid diagnosis. And any case of TB, we give them upfront culture drug sensitivity testing. Any case of diagnosis, suppose a person is diagnosed today, on the same day we refer the sputum also, or within 2-3 days for this CBNet technology. So I wish the private doctors also could avail of this facility, so that you should not wait for the end of 6 months and say this patient is resistant to treatment. Right on the day 1, you can come to know this treatment is going to work out for 6 months or not, or change to another regimen.
Correct.
That's the benefit of this CBNet.
What's the treatment of, I think you said this drug-resistant TB?
Yeah.
The span, the time? And
the span I said it's about 2 years. There are about 7 drugs together you have to take, including a daily injection for 6 months. Just imagine.
Yeah, that's a lot.
It's the ignominy of taking the injection. That's because a person is resistant. And if this doesn't work out, there's something called XDR. Okay. Extremely drug resistant.
Wow.
And that's even worse. Okay.
It just seems to get a little bit more complicated.
Yes.
If we want to simplify this and say, what is the prevention to tuberculosis? How do we just not get towards tuberculosis?
Okay, I'll come to the basics. As I said, cough. Okay, it starts with an airborne infection. If people could just have simple cough hygiene, this hygiene is not. If you see hygiene, people just cough out without holding the kerchief, without handkerchief. If you don't have a kerchief, at least use your sleeve. That's what the WHO guidelines, use your sleeve, but the air should not disseminate. As you cough out, there's not only the bigger droplets, but the smaller droplets, they mix up with the air and called aerosols. They just circulate. If just put a breeze, it just circulates. It can go to the person dead corner also. It just circulates. So this cough hygiene is very important. Secondly, wherever you're working, the window should be kept open. Let the natural air come in. Rather than, okay, I'm not saying don't use ACs whenever there's split AC. Once in a while, see that there's ventilation, good ventilation. Then build up your immunity. That's a basic. If immunity is good, okay, if your immunity is good, especially now we have the disease of diabetes is coming up. Many more people are being discovered to have diabetes because they have a faulty lifestyle, faulty food habits. Diabetes, increased blood sugars decreases your immunity and predisposes you to tuberculosis. So also other cases, other lung conditions like pneumoconiosis, smokers, alcoholics, wherever the immunity is decreased, or immunocompromised people, people who are on dialysis, then people who are immunosuppressant drugs. Okay, these people who are more prone to get tuberculosis, so they should build up their immunity. These people should take more care. Coming to the vaccine, BCG vaccine, all of us know, has not been effective because we could say almost 100% of our children are covered under BCG immunization. But if it was so, the whole world has been given BCG, but it's not. So that BCG only protects the children, and it protects them from a severe form of infection, but it cannot protect. Right now there are trials going on for the new vaccine. There are a lot of trials. ICMR also has taken up, Indian Council of Medical Research. They are working on a trial, and I hope within 3-4 years we are going to get a BCG vaccine. Just like how polio is eradicated because there's a polio vaccine. Correct. It's on a point of eradication. So tuberculosis, this is our hope. Okay. Meantime, we have to use this simple measures.
Yes, of course.
Like cough hygiene is one thing. I just hope our country will soon learn this, rather than if you see that just people just cough out, spit out anyway. This hygiene should be, this is a normal hygiene that should be maintained.
Well, our health is important, our health matters, and so does the health of our family members and people we are in contact with. Any way that the public as a whole or media can help tuberculosis from becoming an epidemic or growing at the speed that it is.
Yeah. In fact, when you all called me for this interview, I was glad to come because my basic idea was just to share this awareness. But this awareness of tuberculosis should be done, because unless people know about it, a simple thing like cough or low-grade fever 15 days or so, report to the nearest doctor, maybe public or private, whoever, report to the doctors. Okay, don't stay at home, because otherwise the disease develops. As you just mentioned, some people don't have the symptoms at an early stage.
Yes.
Diagnose it early. So this platform is a nice way of disseminating this information. Also disseminating to the private sector that we want joint hands with all the private doctors to eliminate tuberculosis. Tuberculosis, see, if we don't eliminate tuberculosis now, our next generation will suffer. We should make our next generation, the environment, the atmosphere free of tuberculosis bacilli. And that's what our government of India has. They've come up with some national strategic plan for 2017-2025, where our Honorable Prime Minister has said by 2025 TB should be eliminated. So we should join hands with the public and private sector in a mission mode. In fact, we give a lot of talks also to the education department, to other departments also, to have an intersectoral approach, okay, to tackle this disease. Because unless it's a joint hands, and the private sector, I would request all my colleagues in the private sector, we are offering free drugs and a free treatment even to your patients. You all can keep the patients with you all, can hold on with your patient, need not refer it to us. If you can treat, well and good, but take the drugs from us. Avail of the free CBNet the technology which gives you a free diagnosis.
So the takeaway from this conversation, for sure, for all of our viewers, is one, tuberculosis can be diagnosed absolutely well in a very short span of time, both in the north and south of Goa. We have the treatment which is readily available, of course, and curable, and TB is highly curable. The final question, Dr. Max, I would like to ask you is, when a family does realize that a person in the family has attained tuberculosis, what should their first, action or reaction towards the patient be? A very genuine.
People should take tuberculosis like any other disease. They should not shun the patient. Now, in a few houses which whenever we go on a supervision, especially the people who don't have much literacy, okay, they shun the patient away, and it's very sad. And even we have been coming across MDR patients, sad to say, they are almost thrown out of the houses once you come to know you're a drug-resistant tuberculosis. It's thrown out for what? They're just human beings, and we tell them you're cured. But where will you go? We admit them in hospitals, but how long for 2 years treatment? I mean, it should be more like a human approach. It's like more. It's a disease like any other disease. All the support and care, and other things, basic things are give him good food and nutrition. Double up his food quantity because he needs more calories, more proteins, more carbohydrates, less of fats. But double up his food intake, and follow simple cough hygiene, just a kerchief, that's all.
All right. Another question that we'd like to ask you, Dr. Max, is when people travel from India to any abroad country for a longer span of time, they have to go to a tuberculosis test. How does one take the precaution and get a negative and not a positive onto the test?
Okay. Now what happens in countries, for example, in countries in the West or Europe, US, the incidence of tuberculosis is very low and their infectivity is very low. They are not infected with the tuberculosis bacilli. As I said, 40% of our population, now 480 million Indians are already infected. So when you are already infected, you already have the immunity to it. So we don't succumb so easily. See, we meet a TB patient every other day on the road, in a packed bus, or you can meet in a superstores or a marketplace, we meet them. But there, if one TB patient goes there, these persons are never infected with tuberculosis. The moment they get it, they succumb to the disease.
Correct.
So they get very scared if any person from this country who has this means. If you do a test, 40% of us, suppose there are 10 of us here, 4 of us already will have the infected at PPD test. It's called a Mantu test, a PPD test positive.
Right.
So that's what they're scared of, a PPD positive. So what are this thing? Means you can infect others. You can infect them because their immunity is weak. It's none of our fault.
So what is the precaution?
One of the precautions, this is called latent tuberculosis, is to take INH prophylaxis for 6 months,
all right,
which they follow in their country. They have a small population. Anyone who is PPD positive, they give them INH prophylaxis for 6 months, which we do not have in Goa because we have that inborn immunity. So at the most, a doctor can just write certify saying that chest X-ray is normal. I've done it myself. I've written for many people. I've given certificate that this person is not suffering from active tuberculosis.
All right.
Another thing, what these overseas companies do, they go for a medical check and they come with an X-ray. A patient who has been treated about years back, he comes with an X-ray, it shows tuberculosis.
Okay.
And then we have to certify. I have to certify that this is not an active tuberculosis. This is a scarred lesions.
All right.
You suffer from tuberculosis. You had suffered some years back. That scar remains.
Okay.
If an accident scar remains, it will remain to lifetime.
Of course.
So need not be tuberculosis. So a chest expert will tell you this is active TB or not active. So if you justify it and put your stamp,
it makes
with authority saying it's not tuberculosis, that's all.
All right, so you're going to make sure that you have an authority test that you do not have tuberculosis, and make sure if there is that latent, probably potency in your body, you're going to take the drug for 6 months. I think
we all have those who are PPD positive. We have that organism till our grave organism remains. When we die, the organism dies with us. But if any stage immunity goes down, this dormant bacilli flares up and manifests itself into a disease.
All right.
Otherwise, there is no
quite fair. Well, we're very thankful to you, Dr. Max Disa, for being here with us and giving us so much of information, especially telling all of our, viewers that it is such a disease that we don't need to get scared of it. The treatment, the diagnosis, and everything is available, and that your team and you are doing a fabulous job to make it aware and much more receptible to the people. We also thank you for being here from the St. Luke's Medical Guild, and I hope that your quest of getting tuberculosis-free Goa and India happens by 2025.
Yeah, with your cooperation of the media. Yes.
All right. Thank you so very much for being here.
Welcome.